From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Wednesday, September 15th. I'm David Crabtree. Here's the latest on the metrics and trends in our state from the WRAL data trackers. With Tuesday's new case count, North Carolina is now averaging a bit more than 6,500 new cases of COVID per day, a number we have begun to see go down slightly over the past week. Just under 3,700 patients are being treated in North Carolina hospitals, 685 on ventilators. That's the most we have seen since the beginning of the pandemic. In response to the severe strain on hospitals, this week tents went up outside UNC Rex in Raleigh to help with the emergency room overflow. They will allow the hospital to expand its emergency department waiting area and treatment areas. The strain on resources is also prompting many hospitals to delay or cancel elective surgeries. These are procedures that may have been on the calendar for months, meant to improve your quality of life, like a hip replacement or knee surgery. With more on that, here's WRAL's Amanda Lamb.
A lot of surgeries that aren't life-saving can be life-altering. For example, back surgery. If you have one of these elective surgeries on your calendar, there's a good chance it could be canceled. Due to COVID, hospitals are telling us they simply don't have enough beds for patients post-surgery. You finally got up the courage to have that surgery you've been putting off. And then
sometimes 72 hours prior to their surgical date, we're saying, I'm sorry, we can't do that surgery today. And then we're not giving them a date. So, we're canceling it, but we're not able to say, well, this is the date we're going to go ahead and do your surgery.
Beds at UNC Health Southeastern in Lumberton are so full with COVID patients, there are no beds for patients after surgery.
We have had to make the difficult decision to delay elective surgical procedures that require an inpatient bed.
For example,
so someone that's waiting on a hip replacement or a knee replacement, surgeries that require that overnight stay, we're not able to do that right now.
We have purposely reduced our non-emergent surgeries that require an overnight stay by about 30% at this point.
At the UNC Medical Center in Chapel Hill, COVID patients are also taking priority over post-surgical patients as far as beds go. But like other hospitals we spoke with, they have a team to decide which surgeries are most pressing.
We're absolutely prioritizing the emergent surgeries.
We're letting the surgeons make those decisions so that we're best serving the patients.
But it's hard to serve the patients during this crisis. Officials at UNC Medical Center tell us 86% of their COVID patients are unvaccinated, and 93% of COVID patients in their ICUs are also unvaccinated.
Those unvaccinated individuals are absolutely placing a big strain on our hospital resources.
All of the hospitals we spoke with tell us they are delaying some elective surgeries, deciding this on a weekly basis. Here at UNC Rex, they tell us about 20% of their elective surgeries have been postponed indefinitely. Amanda Lamb, WRAL News, Raleigh.
And late Monday, Duke University announced the easing of some of its restrictions. Masks no longer required outdoors on campus. A spokesperson confirms they will still be required for large outdoor events like football games. Masks are still required indoors in classrooms and other public spaces. With the coronavirus update, I'm David Crabtree.